Good morning, dear students. As we are starting the new topic, nursing process, let us begin it with a prayer. Lord Jesus, we surrender all medical professionals into your heart. Bless us with your love and care to provide the care according to your will and wish. Bless all those who are afflicted with corona. Amen. Ave Maria. Nursing process is not a new topic for you. What is nursing? Nursing is caring everyone who are suffering. It may be physically, it may be psychologically, it may be socially, spiritually, in any aspect. What is process? Yes, process is a series of rational thoughts and decisions and acts to attain a predetermined goal. So, what is nursing process? Yes, nursing process is a series of planned action performed by the nurses in caring their clients, and all these planned actions are directed towards a particular result, that is expected outcome or goal, which can be set as the healing of a client or reducing the suffering or a peaceful death, whatever it may be. So a nurse follows process that is known as nursing process. So it is helping her to organize and deliver nursing care. And of course, it is a problem solving approach to enable the nurses to identify patient problems. Okay, it helps to understand what the real problem of the patient. And once after identifying, it is helping her to plan and deliver a good nursing care which is in orderly and scientific manner. So, since you were doing it in your clinical practice and you know it, so it is a revision class. So, let us learn together, think together, and modify together. Now we will move on to the history of nursing process. Okay, who has said the word? Lydia Hall. Okay, she is a nursing theorist, and he has not used the term, but still she has introduced three steps: observation, administration of care, and validation. So observation is almost like today's assessment, administration is implementation, and validation is today's evaluation. So the process is first used by Lydia Hall. Clear? As we were learning it, and as the years are going ahead, so many theories were coming up. Okay, so during those days in abroad, many were devoted their life only for the improvement of the nursing. Clear? So the Lydia Hall described the nursing process first. But afterwards, in 1967, Yora and Walsh, the two are identified and they have given the 3 steps and added one along with that. Okay, that is assessment, planning, implementation, and evaluation. So it is in APIE form given by Ura and Walsh in 1967. Okay, now one is missing is now diagnosis. Fry in 1953 used the term nursing diagnosis, but it was not confirmed till 1974, where Nanda has grouped. What is Nanda? You know, North American Nursing Diagnosis Association. They gathered a meeting and they formed the term, okay, declared the term nursing process. So we can see that in mid 1970s, the adding of diagnostic phase resulted 5-step process, that is ADPIE: assessment, diagnosis, planning, implementation, and evaluation. By the formation of American Nurses Association, in part of standards of nursing practice, they have started to use this nursing process in a clinical practice. Okay, when they were using, they are added some more, and it was found that a 8-point nursing process. So ANA has given the clinical implementation, clinical practice as a part of standard of nursing care. Okay, it is from 1973, and from 1980 it has come to the GNM curriculum, and the revision has happened in 1991. Clear? So in the revision in 1991, they have added or incorporated outcome identification in the planning phase. Identify what should be the outcome of our treatment or even the nursing process. So this is in nutshell regarding the nursing process. But there are even other Johnson's, and there are many other theorists who have suggested regarding the various aspects of nursing process. Okay, but I have taken only few of it and try to remember this. It is important. First, it was mentioned by Lydia Hall in 1955, and afterwards in 1967, Ura and Walsh added assessment, planning, implementation, and evaluation. The term used by the nursing diagnosis was Fry first, but still it has come into existence only with the formation of Nanda, which happened in 1974. So we can see that in the mid of 1970, the nursing diagnosis was added, so it became 5 process. Okay, 5 step. Next is the ANA has implemented it in the clinical area, and even in 1980 it came into the nursing curriculum, and in 1991 it revised and outcome identification has come in the planning phase. Now we'll see what is the definition of Nanda. There are many definitions. I have given only 4, and you can select either any of it or you can study according to your convenience. Okay, according to Nanda, it's in 1990, nursing process is a 5-part systemic decision making method. It has got 5 parts according to Nanda, and it is a systematic decision making method. And what is the focus? Focusing on identifying and treating the response of individual. It may be an individual or it may be a community or a family. So it may be a response of individual or groups to actual or potential alterations in health. Okay, it may be the actual problem. Presently, the person is having abdominal pain. Okay, in future, there may be a perforation if it is due to, okay, there is symptoms of appendicitis. So, potential for rupture and damage. So, what happened? Suddenly taking for the scanning and evaluating whether it is appendicitis itself. Clear? So, doing for actual and even for the potential alterations from in health. So, according to Nanda, nursing process is a five-part systemic decision-making method focusing on identifying and treating response of individual or groups to actual or potential alterations in health. Okay, second is by ANA. Nursing process is a critical thinking process. Yes, nursing process is a critical thinking. Critically, we are analyzing the situation and we are thinking about the situation. Uh, Thinking process that the professional nurse used to apply best available evidence to caregiving. Why it is used? Okay, it is used by the staff nurses, professional nurses, to apply the best caregiving and promoting human function and response to health and illness. Okay, so this is utilized in promoting human function and responding towards health and illness. Okay, this is American Nurses Association has given the definition in 2020. Okay, there are two other definitions. The nursing process is a systematic method of providing care to client, and the nursing process is a systematic method of planning and providing individualized nursing care. Okay, so the first two with other, okay, it is better to study any one of this. Now let us start to see the purpose of nursing process. Yes, the basic purpose is it unifies, standardizes and direct nursing practices. Yes, it unifies us. Now throughout the world, in majority of the countries, we are following Nanda's nursing diagnosis. So everywhere, now you are learning it. If you go to abroad, you will be implementing it. It unifies the nursing actions throughout the world. And it standardizes. Yes, it makes sure that the assessment is done by the nurses and it is recorded, and based upon the assessments, a diagnosis is formed, and according to the diagnosis, care is given. So it standardizes the nursing care. And yes, it is directing the nursing practice towards the expected goal. So it unifies, it standardizes, and it directs nursing practice. Now let us see, even though it is the most important function, there are even other functions. The first one is to identify client health status and actual or potential healthcare problems or need. Yes, to identify what is the health status. Okay, what is today's problem and what can be the tomorrow's problem. Identify actual and expected problems. To establish plan to meet the identified need. After identifying, yes, what is the real need and how we are going to plan about. According to the facility, what do we have? According to the system, what we are following. Yes, establish a planning. To deliver specific nursing interventions to meet those needs. Yes, we identify each need and we plan for each need in nursing process. So specifically, we are planning the interventions for the to meet the needs. Next, to promote continuity of care. Now, one staff cannot work for 24 hours. She may work for 8 hours and another person may come. and the person will continue according to the plan which is done by one nurse, or if it is given by a primary nurse and her subordinate will continue it. Yes, there is a continuity of care. Next is to ensure clear documentation of care rendered. Yes, why this care is being given? If we follow nursing process, yes, the reason is there. From this assessment, we have identified the need. In order to meet the needs, provided this care. It ensure, okay, easily, once this particular method is established, very easily we can implement this documentation. It is helping for the documentation. So we'll see that the purpose, okay, it is continuing. I am concluding this slide. It unifies, standardizes, and direct nursing practices. Okay, other purposes are it helps in identifying the health status, today's and tomorrow's problems and needs, to establish plan to meet the identified need, to deliver specific nursing interventions to meet those needs, to promote continuity of care, to ensure care or to ensure clear documentation of care rendered. It helps in providing individualized care. Okay, now in the ward where there is, we are taking care of all patients who are undergoing maybe surgical condition, but specifically when we are writing, okay, we are considering only the needs of this patient. So, okay, everybody's temperature must be taken. Yes, this particular patient has infection, so there is high chance for getting fever. So let us check it more frequently. Even though there is a routine checking of temperature, but individualizedly it turns. Clear? It comes for specially for the community and even for the family also we can plan it. To facilitate an open interactive nurse-client relationship. Yes, in order to assess the condition, she must go and collect the history and she must do a physical examination through which she has to interact with patient. So it facilitates a good interactive relationship so that even the patient should participate in the patient can participate in the nursing care. And yes, they are the key decision makers. Next is to ensure the quality of care rendered. Yes, if we write down and if we follow the nursing care, we will not omit any part by mistake or even with the problems. Okay, so it prevents omission of care. That means the standard of care is ensured and the quality of care can be given. Okay, and even it can be standardized to facilitate an open. Okay, next is to validate the accountability of nursing practice. Yes, once if a nursing process is formed and if we give care accordingly, we can go back and check. Okay, validate, evaluate. Okay, so whether all the nursing problems were identified, whether complete assessment were done, whether any daily assessment has done, whether daily nursing care plan is formed according to the changing need of a client. Yes, it is a mode of evaluating the quality of care. Clear? And accountability of nursing process. How much she is accountable to the patient. Clear? Yes, we are accountable to every activity. Now, I am accountable to you when I am teaching you. Clear? You are accountable to the patient when you are taking care. And even I am accountable to the management to make sure that the work allotted me must be completed. Yes. So this accountability, this responsibility, slightly even though it is different, synonymously it can be used. Okay, so can be validated. To encourage collaborative interaction with other healthcare members. Yes, collaborative interaction. with other members. Yes, because we have to work together. So make sure that we are having good interaction even with the other department so that it enhances a good nursing care to encourage client involvement, relevant healthcare decision. Yes, it is the client who came towards us. He has the key responsibility of his own health. So make sure that we involve him in the care. For the remaining purpose of nursing process are to provide care that is individualized to the client, to facilitate an open interactive nurse-client relationship, to ensure the quality of care rendered, to validate the accountability of nursing practices, to encourage collaborative interaction with other healthcare members, and to encourage client involvement in relevant healthcare decisions. Yes, these are the purpose of nursing process. The component of nursing process. Component, step, phases, stages. All these are the same. So nursing process. I told now we are following a 5-part nursing process system. Okay, which has got 5 stages or 5 components. So that is assessment, diagnosis, planning, and implementation. These are the 5. So, assessment. So, what is assessment? It is a systematic and continuous collection, validation, and communication of clients' data. Okay, according to American Nurses Association, they say that assessment is a systemic, dynamic process by which nurse, through her interaction with patient and significant others and healthcare providers, collects and analyzes data about the patient. So collecting and analyzing the data and recording it can be called as assessment. Okay, we will learn it in detail later. Okay, next is the diagnosis. Okay, so what is diagnosis? Okay, these are the from the assessment we identify what is the real problem of our client. So nursing diagnosis is a clinical judgment. Yes, it is a clinical judgment regarding, it may be regarding individual, family, or community in response to assessment and even the person behavior regarding actual and potential problems that a nurse is licensed and competent to treat. That is important. Now, to do surgery, yes, that is the competency of a physician. Whatever I can do to reduce this suffering, to prevent this suffering, to heal from this patient, yes, based upon that, we are formed the problem identification that is called as nursing diagnosis. So, nursing diagnosis is a clinical judgment regarding the individual, family, and community. Clear? Which a nurse is licensed and competent to treat. Third is after diagnosing, what we need to do? We need to plan. So, planning is again a systematic process. In order to solve the problems that we identified in assessment and nursing diagnosis, what can a nurse do to solve this problem? So, planning. Okay, she is just critically thinking and writing down what can I do. It is known as planning. It is based upon the assessment and the diagnosis, whatever we have formulated. So it is a deliberate, systematic phase which involve the steps in problem solving of this particular problem. Okay, next is the implementation. Now, whatever is planned to carrying out, clear, according to the client's level, the way we provide care for a newborn, the same condition we may provide entirely different care for an older child because we consider the age, inability, the care that we do for an adult and the care we give for a bedridden patient is entirely different because we consider his physical condition. Yes, even though the problems are same, but the mode of giving care may be different. So we practice it exactly whatever is planned is known as implementation. Next, the last is a evaluation. Evaluation is the fifth step and it is judging whether the patient's condition is improved, whether planning is correct, diagnosis was good, correct, and planned accordingly, and whether could implement it, whatever is planned. Yes, evaluation judges the whole process of nursing care. So, evaluation is a determining to what extent the goal has attained. And if there is any problem, what is the problem where the goal is not completely attained? So go for a reassessment, re-diagnosis, planning, implementation, and evaluation. So this is a cyclic process, and these are the 5 component or steps of nursing diagnosis: assessment, diagnosing, planning, implementation, and evaluation. Now we'll see the characteristics of nursing practice. Okay, there are 10 characters which I am giving you, 11, but there are still more. Okay, according to you, your convenience, you can add up. The first one is it is systematic. Yes, it is a systematic method through which a nurse directs the client care and assessment, diagnosing, planning, implementation, and evaluation. And so for that, she collects the history systematically, identify the problems and the abilities of a patient, and develop a holistic plan which specifies the goals and outcome, and execute the plan in implementation and evaluates the effectiveness. So all these gives us, that means it is a systematic process. It is done for every patient. Since the problem is individually different, so even the care plan or the nursing diagnosis or the even nursing process also is different. It is systematic. It is dynamic and cyclic. It is a continuous assessment. So dynamic, it is always changing. Yesterday the patient were happy, today patient is gloomy. Yes, psychological analysis will come. And since evaluation facilitates to reassessment and re-diagnosis, replanning and re-implementation, it is a cyclic in nature. So nursing process is dynamic, continuous process, continuously changing, and it is in cyclic process. Next is, it is a client-centered. Yes, even though we have 5 steps, since we go for every patient in a detailed assessment and we prepare the nursing diagnosis based upon the patient's collection, the history collection and the data. It is a client centered. Another patient problems will not come here. So client is encouraged, enabled, or to give more and more problems according to whatever he experiences. So the nurse forms it. It is a purely client centered or a family centered or a community centered. Next is interpersonal. Yes, there is a continuous interaction between nurse and the patient. Only with interaction between the client and the family and other health professional, she can plan and implement the nursing process. So, nurse collect information from the patient, from the family, and collects assessment data from the laboratory, X-ray, and even other doctors. So we can see that it is a interpersonal. Clear? So nursing process needs interpersonal communication. Fifth one is planned and goal oriented. Every day, as soon as the patient comes, we have to prepare the nursing process for him or her. But daily must go and assess. Is there any change in deviation? Whether certain condition might have improved, certain conditions might have gone bad. So again, every now and then, whenever the patient's condition changes, modify the nursing process and provide according to the plan. And so even today in planning we are specifying the outcome. So nursing process is a goal directed. It is a goal directed. Okay, next is the universal applicability. Yes, now you are learning it from India. It can be even applied in America because man is same, the needs are same. Okay, there may be cultural difference according to the practices what we do, but basically all are same. So it is universally acceptable. These 5 steps: assessment, diagnosis, planning, implementation, and evaluation. Yes, it can be even applied in any part. Okay, even in any of the majority of the theorists, after formulating the theory, they have even connected with the nursing process. Clear? So the nursing process is a widely accepted, so it has a universal acceptance. It is systematic, dynamic and cyclic, client-centered, interpersonal, planned and goal-centered, and universal applicability is present. It is a problem oriented. Yes, nursing process is a problem oriented and it is formed in order to solve the problems. So nurses support the strength of a client to cope with the problem and encourage to enhance the whatever he can do and understand the situation so that he will be able to participate and solve the problems whatever he has. It is a cognitive process. Cognitive process. Yes, it need intellectual skill in making judgment, in making decision, in order to decrease the client's problems. So critical thinking is really important. So critical thinking is systematically arranged in nursing process. Yes, it is a cognitive process. It is flexible. Yes, once the patient's conditions deteriorate, we can add up another nursing diagnosis or we can add up more nursing diagnosis and we can start off giving, concentrating on it, changing the priority and we can concentrate on it. Yes, it is very flexible. According to the condition, according to the availability of care, the facilities, we can modify our priority and the care. Outcome oriented. Yes, outcome oriented. So, today I am providing this care so that I am providing a comfortable position to the client so that his abdominal pain gets relieved. I am providing different measures in reduction of pain so that the patient had comfort increases. It is outcome oriented. That last is a theoretically based. Yes, it has got a scientific knowledge as a background of it. Clear? So, there are pattern, it is a model, clear, and again it can be formed based upon the Maslow's hierarchy, and we can see that the needs of the client and actual problems of a client, all these are summarized and put up in terms of a problem solution. So it is a theoretically based ground is present for a nursing process. So it is a problem oriented, it is cognitive process, it is flexible, it is outcome oriented, and it is theoretically based. Hope you understood the topic. If there is any doubt, you can ask me. Study, it is an important topic, can come for the exam, especially for the theory and practical, it is equally important. If there is any doubt, please ask me, and I am concluding it. Yes, nursing process is a systemic process where we analyze the whole problems of the patient and provide care accordingly. Thank you.